Welcome to the Literature Review presentation on medication reconciliation. This presentation will cover the significant findings that were derived from the literature review. Objectives for medication reconciliation for new inpatients. Overview of importance of medication reconciliation, relevancy for continued needs of research, literature review and framework, discussion on empirical and theoretical concepts, and in-depth discussion questions. Overview and relevancy for research. Research question: what are the root causes of unintended/intended medication reconciliation errors for new inpatients? Purpose of review study: to study outcomes of pharmacists' engagement of medication reconciliation. The search criteria for this literature review. The search criteria for this literature review was through the Jacksonville University Library and through the Google search engine with the keywords medication reconciliation articles between 2016 and 2019. There was only one article that was searched through the Jacksonville University's library, which is the third article listed in the reference page with the first author's last name as Bruker. This article was not able to be included as a full access online article, and it was downloaded from the computer as a PDF file. Clinical staff who initiate medication reconciliations alone are facing major issues that increase risks of medical errors during transitions of care. Unreconciled medications accounted for 64.5% of one medication error. Due to frequent changes in care, there are no clarification of responsibilities for reconciling medications, which has continued needs for research. Since pharmacy has the medication history, it should be the one to reconcile medications. Possible patient harm could increase if medical errors are not corrected by pharmacists' interventions. As stated from Kreckman et al., 2018, and Spaya and Castillo, 2016. This is the first slide that covers the literature quantitative review. According to Bruker et al., 2017, reconciled medications initiated only by physicians were considered as medical errors, which counted for 98.4% of medication discrepancy errors before pharmacist interventions. Most errors were omissions at 59.3%, second to incorrect doses or frequencies at 33.8%, and 6.9% of medications added inappropriately. These error corrections improved clinical staff's trustworthiness of pharmacists. Shima et al., 2018, a meta-analysis systematic review study, stated significant findings of pharmacists' interventions were associated with an 80% decrease in medication discrepancy-related hospital readmissions. Kreckman et al., 2018, stated the role of transition of care team of nurses had decreased medication discrepancy errors to 57%. However, the errors had decreased to 33% after pharmacies and physicians' interventions. If these interventions were more frequent, the percentage decrease would be more significant. The second slide for the quantitative literature review. McNabb et al. 2018 selected 1,620 articles for a meta-analysis and systematic review study. This literature stated many studies had shown pharmacists' interventions improved medication reconciliation. One of the 1,620 articles reviewed stated 2 hours of pharmacy time equaled 3 hours of nursing and 1 hour of physician time when it came to reconciling medications. McConan et al. 2016 stated of the 19 studies that reported data on medication discrepancies, 17 were involved in 18 medication reconciliation by pharmacist interventions, which 9 of them were needed of correction during admissions. Okay, this is the last slide for the quantitative literature review. Patel, Pavnik, and Canelti 2019 reviewed various literature that had concluded that annual savings of preventing hospital readmissions was over $1.5 million as a result of pharmacist-led interventions of medication reconciliation. Spaglia and Castillo 2016 stated an 80% of medication errors were due to omitted unreconciled medications. After pharmacists' interview of 60 patients, medication lists were collected and 75% of discrepancies were reported to the clinical team. And this last literature by Thompson 2018 has stated an 81% reduction of medication reconciliation errors when pharmacy reconciled medications during patient ER visits before admitting physicians' medication orders were entered. In quantitative literature, negative outcomes of unreconciled medications and positive outcomes of reconciled medications are examples of positive relationships. Decreased medication errors after medications were reconciled and increased medication errors when they were not reconciled are examples of negative relationships. Unreconciled/reconciled medications are independent variables. Negative or positive outcomes of reconciled or unreconciled medications are dependent variables. And now the next slide will cover the qualitative literature review. Okay. Qualitative literature review. Bell et al. 2017 discussed reconciling medications of elderly home care or nursing home patients. These patients' geographic locations were major barriers of timely medication reconciliations. However, an interprofessional team of nurses, physicians, and pharmacists still was able to reconcile medications for home care patients. Results showed healthcare professionals' understanding and appreciation of their roles for reconciling medications and perceived benefits of working together with pharmacists. Clapp et al. 2017 discussed experiences of 5 physicians and 4 nurses reconciling home medications during a study interview. Both groups stated a need of clarification of responsibilities of reconciling medications. They had experienced many challenges related to unreliable information and misguided routines of their roles. This is the last slide that covers the qualitative literature review. McConan et al. 2018 indicated a recent study has shown a high acceptance of pharmacists' interventions for medication reconciliation. Results have shown most pharmacists appreciated their roles. However, lack of awareness of pharmacists' roles and attending to other priorities were major barriers for implementing medication safety. Niederhauser et al. 2018 had stated the nurses who were in the study had perspectives of improved clarity of medication orders after implementation of home medication reconciliations by pharmacist technicians who were supervised by pharmacists. More pharmaceutical staff was hired to decrease the workload. The criteria for qualitative research for this presentation had involved the pharmacological research, which studies life experiences, ethnographic research, which studies the cultures of the participants in the study, and exploratory descriptive qualitative research, which studies the quality of the research that was studied. Mixed methods literature review. McShane and Stark 2018 discussed a training session for medication reconciliation for physician residents. Quantitative results showed a significant increase of accuracies between care transitions went from 67% to 100% after a 1-hour training session on medication reconciliation with consult to pharmacy. Qualitative feedback of training session was positive. However, residents who took the virtual session only had a 41% accuracy versus to 100% from residents who had taken the training session in a classroom. And this literature did not discuss what was the relevancy behind that. Next, a 497-page peer-reviewed doctorate thesis by Reb 2017 reviewed studies of other literature on effective medication reconciliation. Samples of 2,799 primary physicians and 3,439 community pharmacists were recruited in the study. This literature had discussed the importance of a pre-admission medication list for reviewing any discrepancies. However, only 22% of participant physicians agreed that pharmacists had improved the medication reconciliation process, whereas 74% of participant pharmacists stated increased need of their interventions to improve it. Surprisingly, over 40% of general practitioners had reported poor communication with the pharmacists in the study. And this concludes the literature review for this presentation, and a framework will follow the slide. As for research studies, operational definition determines how the measurements of a variable would affect another variable that would be best for a certain study. Conceptual definitions are meaning of ideas that need to be studied. However, they are rarely present in quantitative reports unless the focus of report is a concept. The theoretical domains framework was originally formed in 2005 and published in 2012 by a group of social scientists and researchers who combined 14 chosen behavior work theories into one domain that is called a theoretical domains framework. And it was chosen for this presentation for its relevancy of healthcare professionals, specifically for hospital pharmacists' work behaviors that can be used to assess implementation issues. As stated in McConaughey's 2018 literature, an analysis had shown 6 domains of this framework that influence hospital pharmacists' engagement in medication safety interventions. These domains included knowledge, skills, environmental context and resources, motivations and goals, social influences, and social professional role. Most hospital pharmacists believed knowledge gap, lack of training and skills to implement medication reconciliation. The framework for the literature review on medication reconciliation is a condensed image version of researched components on the outcomes of medication reconciliation completed by pharmacist interventions. For more studies on the theoretical domains framework theory, please refer to the Atkins et al. Literature that's included in the reference page. Discussion and hypotheses. The purpose of this literature review was to provide literature that focused on pharmacy interventions for medication reconciliation that significantly improved outcomes. Licensed clinical staff should consider the importance of medication reconciliation for maintaining patient safety. Colleagues are invited to share this presentation to spread knowledge about the importance of improving medication safety. The hypothesis for safe and timely medication reconciliation is that medication reconciliation should only be completed by pharmacists and admitting physicians before patients arrive to the unit to reduce delayed continuity of care, while nurses report new discrepancies that would restart the process. All 14 reviewed articles stated significant positive outcomes of pharmacy's engagement in the medication reconciliation process. However, further research is needed for this hypothesis to be put into an evidence-based practice. After reading the discussion slide, what are your experiences or challenges of reconciling medications? If you reviewed literature on improved outcomes of pharmacists' interventions of medication reconciliation, why would you agree or disagree with the literature? And lastly, what is the method or protocol of reconciling medications at your place of employment? Would you suggest needed changes at your facility? Why or why not? Thank you for listening. This will conclude the presentation, and I hope that you enjoyed it.